That's Dr. Alex Garza. Mandy just said we were going to talk to him. He's here now. He is the head of the St. Louis Metropolitan Pandemic Task Force.
Dr. Garza, thank you for being with us. We want to focus on your press conference today. You said that emergency rooms in hospitals in the St. Louis area are full. We have seen tents going up for COVID patients. How are you handling the overflow of patients?
Yeah, so it's any of a number of things right now. So, of course, I mentioned that we are having to transport some patients outside of the St. Louis metropolitan area. Now, certainly that's not a common event, but it does occur. But I think that just highlights how strained we are as healthcare systems across the metropolitan area. So other things that we are doing is starting to double up patients in our intensive care units or expanding the reach of the nurses. So instead of having one nurse for every 2 patients, expanding that to 1 every 3, things like that. But you can only stretch so far before you have to start looking for alternative sites or thinking about how can I take care of the most amount of people with what I have.
I guess on the heels of that question, Dr. Garza, you said today that ICU beds were full and that you're now being forced to send patients as far away as Hannibal and Quincy. If you could please explain this, is this because you just don't have the staff?
Well, yes, as we've said before, it's not a question of beds per se, physical beds. We have plenty of physical beds. We don't have enough staff in order to take care of patients that are in the beds. And so on any given day, that number of beds fluctuates up and down, and there's a couple of reasons for that. One is nursing is at a premium right now across the country because of COVID and because there's just a nursing shortage across the country. But number 2 is we have a lot of staff that are going out with illness, quarantine, and isolation because they're being exposed to COVID out in the community. And so when you have that decrease in your staff, you're not able to take care of as many patients, and therefore now we're in this crunch where we can't take care of all the patients that are showing up at our emergency departments.
Dr. Garza, we have a graphic right now. We want to show our viewers of the numbers growing across the region. Here is St. Charles and Clinton counties. And as a result of these growing COVID numbers, are you going to recommend a complete shutdown after Thanksgiving?
Well, I think it depends on what you mean by a complete shutdown, but I think that is one of the few options that we have in order to get cases down. So I've advocated before for a safer at home policy. So that depends on, which businesses you deem are essential and non-essential. But clearly we can't sort of piecemeal our way out of this. It can't be masking mandates here but not there. It can't be venue restrictions here and there. This is how we've ended up where we are right now. So one of the things that we do know that will bring cases down significantly in a short amount of time is by shutting down those different businesses.
All right, Dr. Garza, you've always shot us straight. We're in a bad situation right now with the numbers in the hospital situation. So what do you expect to happen? Modeling predicted hospitalizations toward the 2,000 and 3,000 patient level. How quickly could this happen?
Well, if we're going at the rate that we are right now, it could be within the next couple of weeks. I know in the hospitals that I visited today, the ICUs were full. As I mentioned, there was 1 ICU bed available and there were 3 patients waiting for it. And so half the time our staff spends calling around to different healthcare systems to see if there's a bed available somewhere else. And all the while, patients continue to come in through the door. And so it's, this rate is unsustainable.
All right, Dr. Alex Garza joining us now live. Thank you very much. We will be checking in with you in the days ahead. Thank you for bringing us up to date on the pandemic.